Peter Goertz here. I'm a psychiatrist. Some brief comments about PTSD and Vietnam combat veterans. One aspect is if you treat patients like that, it can be good and maybe necessary to process what you hear because you hear a lot of hear about a lot of extreme experiences and the consequences of those experiences. The Vietnam combat veterans had both the post-traumatic stress problems from the actual combat and the surroundings of the combat, the things that were connected with the combat, but then also when they returned home to the US, they were ostracized to a large extent. So it was another level then of something difficult to deal with, kind of a double trauma in that sense. So briefly, to give you a sense of some of these patients, for about 4.5 years, I worked in a VA clinic. And one example is a gentleman, a Vietnam combat veteran, who was actually demented, did not know the day of the week, did not know the month. And he was sitting on the stretcher behind me, and I was talking with his wife. And I was evaluating him, and she was trying to give me a little background about what his situation was and what happened. And she mentioned the word Vietnam, and then all of a sudden I hear spontaneous sobbing from the back, from behind me. So he was not even oriented, but the word Vietnam just triggered that response of violent sobbing and crying. So these things run very deep, and these people went through an enormous amount, which is an understatement. Another example that comes to mind is a 19-year-old man who was had just arrived in Vietnam, and he came upon a Viet Cong soldier who was wounded, and the Viet Cong soldier begged him not to kill him. He showed him pictures of his wife and children, and this 19-year-old man was with two other young men, and none of them wanted to kill him, but their superior ordered them to kill him. So they drew straws, and my patient drew the straw that meant he had to kill the guy. And he never got over it. And it's understandable because he'd just been in Vietnam for a week. Within that week, everything he'd learned spiritually, he'd been to church, etc., had a religious background, all of that came into question within 1 week at age 19. Another example, and these are common things. I was sitting with a veteran and the phone rang and the veteran almost jumped off the chair. They can startle very easily, and often they used to sit with their back to the wall in the office just to feel safe, facing the door with their back to the wall. So there's a constant need or desire to be vigilant. And another gentleman that comes to mind is a gentleman who had helped his wife deal with breast cancer. He'd been very supportive. But this gentleman, related to his experiences in Vietnam, he was very depressed and chronically suicidal. And he did not feel his wife deserved to be with someone who was that depressed and could not really enjoy life, in spite of the fact that he'd supported her through breast cancer. So I encouraged him to leave it up to her because I'm sure she wanted to support him because he'd been very supportive to her also. So there's a lot of difficulty seeing the world the way other people see the world because of what they've been through. And temper can be a huge issue with Vietnam combat veterans and combat veterans, of course, in general. A veteran now in his 70s was standing in line and someone got too close to him, and he did not feel comfortable because of COVID. And he got into a verbal confrontation in his 70s with the man standing behind him. So those are some things that can give you a little bit of a feel of how these people have suffered and continue to suffer. Often before they go to bed at night, they check the perimeter of their property, kind of a military type habit. Often they seek help or quote help with alcohol and drugs, and everyone suffers. The veterans suffer, the families suffer, the children suffer, and you can imagine growing up in a household with a veteran who's very troubled. And often these people, like I said, they were ostracized when they returned from Vietnam. They did not have any help offered to them. They were not educated about PTSD. A large number of them didn't realize they had PTSD. They didn't understand what was going on, and they just tried to help themselves feel better with drugs and alcohol. So as far as treatment, we want to support any patient, and we want to empathize with the veterans who've been through trauma, with anyone who's been through trauma, but we want to avoid supporting a victim mentality, and that can be easy to fall into a victim mentality, and it can be easy to, as someone who treats the veterans, let them fall into that mentality or not help them get out of that as best one can. So one basic thing with PTSD is time. It's like the past is still present. I remember a veteran, and I talked about this in another video, a Vietnam combat veteran was sitting in the waiting area, and I approached him and I called his name. There was no reaction. His eyes were open, he was just sitting there, but he didn't look up. I called his name, second time, no reaction. The third time I was pretty loud, and he just startled, and he had, in his mind, been literally back in Vietnam. And this was a gentleman, I think around 70 years old already. So this is about, almost 50 years back he was going. And so it's literally the presence of the past in their experiential world. Another thing that struck me at the VA was often these people who went through Vietnam already had major trauma in their life before they even got to Vietnam. Like suicide of a parent while they were in the house. So these people already came to Vietnam, and then in Vietnam were further traumatized. Another aspect, I'm not going to take too long, but another aspect of PTSD at the VA is financial benefits. And it's a little bit of a strange system, to me it seems that way at least, because sometimes the veterans who are most incapacitated by post-traumatic stress disorder, they're not able to even sit down and talk about the things they experienced, and because of that, they can't get the benefits. So it's kind of like going in circles, and it's really detrimental to those veterans who really needed the help, but are not able, because it's so traumatic for them to even talk about it. I remember one specific veteran who was not even able to sit in the waiting area. And the reason was because he did not want to hear other veterans talking about combat. He just could not cope with that. So this veteran was very troubled, not able to function, not able to talk about his experiences. And because of that, when he was evaluated regarding PTSD with his request for benefits to get benefits for PTSD from the VA, he did not receive the benefits because he was unable to express what happened to him in Vietnam, what occurred in Vietnam, what led to him having post-traumatic stress. So it's a strange system. And each veteran is different. Some veterans, I remember one particular veteran, some veterans do not want benefits. It's very interesting. There was a veteran in treatment for PTSD at the VA who just did not want benefits. One veteran, another one I'm remembering, was functioning well, working, but very troubled, not able to sleep, nightmares. And he did not get benefits because they felt because he was working, that showed he was, quote, functioning, but he was still very troubled. So briefly, and maybe I can talk about this in another video, basic options for treatment with PTSD, psychotherapy, probably the main thing, psychotherapy and group psychotherapy, those two. Medications can help with symptoms, depression, sleep, nightmares. Now the VA is doing other things like yoga, meditation, Tai Chi, acupuncture. And another thing that helps a lot of the veterans, I remember that specific veteran who was too troubled to talk about his experiences. He, for instance, really enjoyed spending time with alligators. Just being in nature, being away from human beings. These veterans, in my experience, had a lot of difficulty coping with human beings. They preferred nature, preferred being around animals, for instance. All right, thank you.